Good morning, everyone, or it might be afternoon for some people in different parts of Australia. Thank you very much for joining today's webinar, which is going to be focusing on housing first and the principles of flexible support for as long as needed and active engagement without coercion. Before we get started, I just would like to acknowledge the traditional owners and custodians of the land on which we work, live and build our lives, families and communities. We pay our respects to the First Nations of this country, their cultures and elders past, present and emerging, and extend that acknowledgement and respect to any Aboriginal and Torres Strait Islander people here today. And I would just like to acknowledge that I'm on Whadjuk land and part of the Noongar Nation. So unfortunately, Sarah can't be with us today, but I would just like to acknowledge the contribution that she's made to this webinar. My name is Michaela McMahon. I am from the West Australian Alliance to End Homelessness. I'm part of the Train the Trainer Housing First programme. So throughout the session, if you have any questions or comments or ideas, pop them in the chat and I will, there's something going wrong with the slides. Sorry, pop them in the chat and I will try and make some time to allow for some questions at the end. But if I don't get to them, I will absolutely follow them up with an email. Sorry guys, there's something. Okay, so just to recap, what is Housing First? So for those of you that are just joining us today and might have missed out on the first couple of sessions, Housing First is an international model of housing and support for people who have experienced long-term and reoccurring homelessness and who face a range of complex challenges. Housing First isn't for everyone. It's a specific approach for supporting strategies to end homelessness and is a methodology for effectively assisting some of the most vulnerable people within our community. If you attended the last two webinars, you will have heard about the principles of people have a right to a home and housing support is separated. If you missed those webinars, you can find those recordings on the Council of Homeless Persons YouTube channel. And I would encourage you to watch them yourself or within your teams and your team meetings. Remembering they're only 30 minutes, so you should have time. They're a good option for lunch and learn. So we'll start with flexible support for as long as needed, which incorporates continuity of support and holistic approach, intensity of support, accessibility to support, and the relationship that is formed. Before we look at that principle of flexible support for as long as needed, I'd just like to hear from Roy, who is included in a J2SI programme. So who was housed through the Journey of Social Inclusion programme, which is J2SI through Sacred Heart Mission, who had a baby and a partner when he was housed. So when asked about his experiences of J2SI, this is what he said. So when you rang, I was in a semi-reflective state and everything just came flooding back over the last 4 years. I was looking at where I was, where I am now, and what would have happened. With J2SI, you were able to take your time, and that's the thing, J2SI did not rush me. We had 3 years, and that's the thing, if it had been 12 months, yes, it would have helped, but everything would have been rushed and I would have felt pressured. I guess this and so many other lived experience stories emphasises the importance of developing service delivery frameworks that are flexible and that reflect the need of the participants rather than the funding arrangements. I'll pop the J2SI report link in the chat for those of you that want to read more about the benefits of such programmes. Feel free to read through that. So continuity, which is our first one. Jumping into that, which lends nicely really into Roy's reflections of J2SI and the support that he received over the 3-year period rather than 12 months of support. People with long and repeated episodes of homelessness and the impacts on people's lives and health may mean that they require more than 12 months of support. We can't expect people to be fixed in 12 months, especially after spending 10 plus years on the streets. And in Housing First, we advocate for no fixed end date to support. However, at the moment, some of our contracts don't allow us to provide continued support, and that can be quite hard to manage. But we want to try and be as flexible as we possibly can. Holistic. So as much as organisations might train workers in cultural practices, it can be difficult to ensure we're providing appropriate support. Simply asking people if they want an Aboriginal worker, a male worker or a female worker is very much dependent on what the service has available, and is often something that we can't always accommodate through our services. There is a necessity to ensure that Housing First initiatives are both driven by and responsive to the needs of Aboriginal people themselves. And this includes offering flexible models of support, which are inclusive of the unique social and cultural needs of Aboriginal people, including families and kinship and connections, and understanding country and place. There is a particular critical need for additional Aboriginal support workers to provide cultural appropriate supports for tenants, and Aboriginal controlled housing providers are best placed to provide holistic responses to the many systematic barriers to housing that Aboriginal people have faced. So now, unfortunately, we have different criteria for contracts, which sometimes prevents people getting the support that they need because they might not fit all of the criteria. And the choice regarding what we can offer within our services is really dependent on what we actually have available. Intensity of support. So long-term wraparound agile support for individuals and families is vital when we're providing a Housing First response. And even well after they've been permanently housed and housing is secure, they can still need that support. So long-term in Housing First means there is no end date. And as shown in the 50 Lives, 50 Homes programme, and I'm going to ask Trish to pop that into your chat, so you can find all of the 50 Lives, 50 Homes reports, evaluation reports with that link. From reflections on that report is that the intensity of support needed can vary over time, and in some cases over many years. Services such as after-hours services, should really be embedded at the heart of future Housing First initiatives to ensure holistic support is available for people who are housed to assist them in maintaining their tenancies long-term. Accessibility. With criteria of programmes which we mentioned earlier and contract periods of support, it can be really hard for people to re-access services. The likelihood is, if somebody is contacting you or your service, it's almost always at crisis point. They don't tend to contact your service 6 weeks prior to having a crisis because they know that it's going to happen. They're contacting your service now because they need support now. Again, at present, we generally close support periods when people seem to be doing really well, or sometimes are deemed as having disengaged because they don't need support anymore. And once closed, the person may not be able to get the support that they require in the quickest time possible, which inevitably impacts them further because they're not getting the support that they need right now until 6 weeks down the track where there's an open and available support for them. So I would challenge you after this webinar to think about how you might be able to change that approach with your current workplace. Is there something that you can tweak in your processes that if somebody's already accessed some support with you, is there a time frame where you can provide some casual support to that person if they re-engage because they've made that connection with your service and they're at the point of crisis, otherwise they wouldn't be contacting you? And the last one, around flexible support for as long as needed, is about the relationship. So the relationship element of flexible support goes hand in hand with the availability element of active engagement. And this is why it's so important to have lower caseloads, which I'll speak about a little bit further on. When we're working in a housing first model, a lower caseload is really important. It takes time to develop meaningful relationships that are built on mutual respect and trust. For people who have experienced many years of homelessness, being exposed to or impacted by trauma and have multiple complex needs, it's going to take time to develop a strong relationship. We're often stretched and have lots of questions, but the details are often in the person's story and what they choose to share. We really need to take the time to sit and listen in a place that's comfortable for that person. And again, it's something that I would encourage you to do after this webinar, is to have a think about the next time that you're meeting somebody new for your caseload. Be mindful of how and where your initial conversations take place. This is the beginning of your journey together. The thing that I would say around this as well is, I remember about the fluffy stuff, is that some people think that fluffy isn't important. Like, it's the fluffy things that you do that build a relationship, the things that you can help with, the practical things, the things that people might enjoy, that you might think, or other people might think is just something small, that can actually make somebody's day and actually be the beginning of forming a really solid relationship. So active engagement without coercion. So we're moving on to, I guess, active engagement without coercion, which includes responsibility, persistent, compassion, availability, and trust. And to start this principle, I'm just going to show you a quick video clip from some training conducted as part of the Pathways to Housing programme, which Dr. Saberis founded in New York in 1992, and based on the belief that housing is a basic human right. So if this works, I should be able to do this.
It's all negotiation, I think.
Right. There are no stinking rules in ACT. You know, the rule is you better provide services to people that are in line with what they want, or they're not going to open the door, or they're going to be in the house and they're going to pretend that they're not there, or they're not going to be there when they know you're coming, or when you walk in they're going to flip you off because they can. So the whole power dynamic changes in ACT, and that's a good thing.
I think the hardest part from the person out.
So as stated in the video, the importance of providing services to people in line with what they want. And this principle is about shifting the power dynamic to provide people we're working alongside the power to make choices regarding their own support. With responsibility, this is a shift from the staircase approach, where workers are expected to build and maintain an authentic relationship, which enables greater chance of engagement. It's about the worker taking responsibility to connect with the person in a place or at a time where they feel safe to do so. It isn't about blaming people for disengaging or saying that you didn't turn up for free case management appointments, therefore we have to exit you because this accommodation is for people that want to engage. It's about taking the time to understand why they weren't available, and really digging deep and asking open questions to understand what might work better for them next time. Persistence. In a similar vein to responsibility, it's up to the worker to regularly check in and offer support to people, providing them with choice around the level of engagement within the programme, and finding what works best for them and being flexible with what support may look like for each individual or family. There's a fine line between checking in constantly. You don't want to appear that you are hounding the person, and you may put them off engaging with you further if that is the kind of feeling that they're getting. It's about checking in and being with purpose and being meaningful, being thoughtful and not rushed in your approach. So if you're about to ring somebody to check in, have a think about for a couple of minutes what it is that you want to ask them, how you're going to engage them if they answer the phone and they don't sound like they really want to be engaged in a conversation. What's something that they really enjoy that you can use to kind of get them engaged in a conversation? It's important that the amount of time and the amount of support provided is driven by the person and not by contractual or service requirements. Compassion. This is where building authentic relationships is such an important part of Housing First. Having a foundation to understand, having a foundation of understanding, empathy and respect that paves the way for achieving positive and long-term outcomes. A deep understanding of people means that support is designed to fit the individual or family, rather than the individual being required to fit the service. It isn't only about securing and maintaining housing, nor should it only be focused on the completion of service required paperwork and assessments for contractual expectations. We need to be mindful and creative at times. People who have been in and out of the system since they were children will have had to complete many required documents before. Ask people how they'd like to share this information. If you join us next fortnight, Charlotte and I will be able to give you some great practice tips to share with these principles. Availability. So this is why we advocate to have lower caseloads, which I mentioned before in a Housing First programme. And by having small caseloads, this varies in different countries and programmes, but generally we'd say under 10 and 10 being the absolute max. By having small caseloads, it provides workers the capacity to be flexible with their availability, actively responding when needed, and sometimes shifting their work times or days to support someone when it's most needed. And as the slide says, doing whatever it takes to support that person. Unfortunately, the sector can be stretched at times with high caseloads, and there can often be periods where we don't have enough time or capacity to build authentic relationships with people. And this can also be due to contractual requirements and working hours. I guess what I would say is that working with vulnerable people isn't generally a 9-to-5 job. And, you know, we can't say to somebody at 4:30 on a Friday, can you just hold that crisis until Monday when I'm back on shift? We need to be flexible and we need to have flexible working arrangements to be able to support that and contracts to be able to support that availability too. And if we can't have a flexible working environment, we absolutely need to partner with other organisations that we can share that responsibility with, feeding into that point and being holistic in a Housing First programme. And the last one is trust. So being open, transparent, culturally aware and following through with what you say is vital to building trusting and strong relationships with people we're supporting. Ideally, we want to provide people with the opportunity to have input into service decision making. Similar to being holistic, some people may have traumas attached to certain genders or fear of breached confidentiality within cultural settings. So only having one option for case management for some individuals and families may not work. People who are very vulnerable with a long history of homelessness have experienced being let down by the service, system, people many times. So you might think that making a small change or not following through with a small task is insignificant, but it's not to the person that you're supporting. If you know things are going to change, provide people with notice and time to process the information. I'd say this goes with the same as leaving a job. When you're working with people without knowing, you might be somebody that they feel that they've developed a connection with. And if you're leaving, it can have a knock-on effect if you don't be transparent with that person. I would say that if you are leaving an organisation and you've been working with a load of vulnerable people, that if you give them time to be able to process that you're leaving and introduce them and do a warm handover to somebody else, it can help maintain that trust with that organisation service long after you've gone. I'm just going to stop the slides there. and see if anybody's got any questions, comments.
Thanks so much, Michaela. We've had a question from Luke, who asks if you could speak to how you maintain self-care and longevity within a workforce while working to these principles.
Self-care and longevity. I think that comes down to, I guess, you have some responsibility and accountability to look after your own self-care and put some things in place. So, you know, there are some great apps that will help you to do that. But there also should be, you know, I guess you should have a work culture and environment where your workplace is supporting you to be able to work in the Housing First principles. Also looking after, you know, making sure that you're supporting the people that you are supporting through your work, but also supporting yourself. I think that, as the saying goes, self-care isn't selfish. If you don't look after yourself and make sure that your cup is full, you can't look after anybody else when your cup is empty.
Thanks again, Michaela. I had a quick question around, having read some of the information on the 50 Lives, 50s homes and the work of those after-hours services, who I assume were not SHS funded, and their role in supporting people after hours when potentially for organisations they might not yet have that flexibility to provide after-hours support. I was just wondering if you could talk to what your understanding is of that importance of a multidisciplinary approach.
Look, I think a multidisciplinary approach is well needed. I think that if you don't have the luxury of having a service like After Hours, it's around, and I think I mentioned this in the slides before, it's around being able to form some partnerships with other organisations where if your organisation only works to a certain time, is there another organisation out there that you can partner with to be able to provide that extra level of support? What I will say is that the benefits, and please do go and have a read of the 50 Lives, 50 Homes evaluation around that, I guess that holistic and multidisciplinary care, is that there's so many benefits with that for not just the person themselves, around building resilience, around, you know, empowering them to have a toolkit of strategies and resources that they can tap into. So when they get to a period in their lives where they don't need an after hours support anymore, they've got a backpack full of information, strategies that they can call upon to be able to access, and they can do that themselves because you've helped empower and build that resilience. But also, as a knock-on effect to that as well, is that if we provide support to people where they feel safe in their homes, it prevents them to going to A&E and the hospital or calling the police, which can be a traumatic event within itself. You might feel like you need to go to the hospital because there's something wrong and you can't get the support in your house. But then when you get to the hospital and you're waiting in the wait room for 4 hours, you're also impacted by all of the people that are also sitting in that wait room. Your levels of anxiety will go up. It's the same with, you know, when you're calling emergency services, is that sometimes you can have an absolutely brilliant interaction with, you know, emergency services, and sometimes it's not a good interaction at all, which then feeds into the way that you'll be feeling and can set people back, you know, along their journey, rather than it being a positive experience. So I would absolutely advocate for partnering with other organisations to provide that wraparound holistic response, rather than, and building that person's capacity and resilience, rather than that person going back to the hospital time and time again. It also saves money on the hospital system, which is a win-win for everyone.
Thanks so much for responding to that. I think that's it for our questions that are coming through. I have put a little link to a short evaluation on today's webinar, which we'd very much appreciate if you could take a second to do.
Brilliant. And I would also just like to say thank you to the Council of Homeless Persons and Homelessness Australia for bringing these webinars to your screen. I would also encourage you to log on to the YouTube channel and watch the ones that you've not seen if you've missed the first two. And you can also join Charlotte and I for the next instalment. for flexible support for as long as needed, and active engagement without coercion in practice, where we'll be giving you some practice tips. We'll be talking to you about some of the, or reflecting on some of the best practice that we've seen within Australia and elsewhere around creative ways of, you know, maintaining engagement and also providing that flexibility of support. So we hope that you will join us in a fortnight's time to see that.